Good morning. I'm Francesca Vaghi. I'm a Senior Development Officer at the Health and Social Care Alliance Scotland, and I'm delighted to be joined this morning by Annie Cook and Amani Ayewe, who join us from DEMSOC. And we are here today to discuss a recently published report that the Alliance commissioned from DEMSOC. So delighted to welcome you both. The project name is Engaging People with Lived Experience, Best Practice, Challenges and Opportunities. So before we get into the meat of the discussion, could you both just briefly introduce yourselves and say a bit about DEMSOC and the work that you do?
Yeah, just very briefly, I'm Annie Cook, so I'm based in Edinburgh and I'm a Network and Delivery Manager.
And I'm Emily, and I'm a research assistant, and I'm based in Luxembourg.
So DEMSOC, we're known as Democratic Society, but we get called DEMSOC for short. So we're an international non-profit org, but we're based across Europe and the UK. So our main work is around creating opportunities for people to take part in democracy and different types of democracy. So that could be things like participative or deliberative forms. So for example, where people are reaching agreements through consensus. So we undertake practical projects that might shape policies or future strategies. So for example, things like Scotland's Citizen Assembly or participatory budgeting, Scotland's AI strategy, public engagement work. So these are just Scottish examples, but there's lots more. But yeah, our aims of our work are essentially to create spaces for people to make decisions about the things that currently or could affect their lives in the future. And we've got a research and design team, so we're also trying to sort of work towards democratizing how research is done as well.
Okay, fantastic. So, as I said in the introduction, we asked DEMSOC to carry out this project on engaging people with lived experience and finding kind of best practice approaches on how to do that. And it was a Scottish example, so one more for the list, Annie. Can you say a few words about this project and what the Alliance commissioned you to do?
So, Francesca, you mentioned this earlier, but just the title of it was Engaging People with Lived Experience, Best Practice, Challenges and Opportunities. So it was a research study on involving people with lived experience into health and social care policy and decision making. So the purpose, looking at health and social care policy in particular. And the main bits of our work was a literature review to look at the latest evidence and learning on how to meaningfully include people with lived experience in decision-making processes on health and social care. And then we also did a workshop to complement that lit review with people with lived experience in Scotland, a feedback questionnaire, and then interviews with policymakers working in Scotland, some of them on health and social care policy and some of them just in policy in general.
And then I can add a few things is that, yeah, overall the research was a qualitative research. So when we had the workshop, we had open-ended questions with the participants, so they were able to give their own experiences of working in decision-making processes, but possibly also the barriers and enablers that they faced when they were working. And then in the interviews with the policymakers, we had semi-structured interviews and also trying to get the kind of policy landscape when it comes to lived experience in Scotland. And then they also gave some examples that they had worked on lived experience or engagement on lived experience, and then possible the barriers and enablers that they faced in this work. So that was the whole thing. And then we analyzed the notes from the interviews and the workshop, and then also the responses from the feedback. And that's how we did our report.
And having read the full report, I know there was really a lot that the research covered, and I really was impressed by all the findings. You've already mentioned, Amani, a bit about how you went about doing the research and that it was a qualitative piece of work. Is there anything else you would like to add on how you went about carrying out the research or the methods that you used?
Well, we wanted to make sure that the participants were able to, in the workshop and the feedback, that they were able to be themselves. So that was having a safe space in the workshop as well. And we also anonymized all participants in the interview, feedback, and the policy workshops. So no one's name, any identifiable markers were not used in this research report as well. And just making sure the participants were able to speak whenever they wanted and not on topics that they did not want to. So that went from the interviews workshop and the feedback questionnaire as well, that participants are able to give input to the degree that they want to and are able to.
I feel like aside from the findings that then we'll explore in just a minute, even that in itself is an example of best practice approach in how to engage with people with lived experience. So thank you so much for sharing that. So as I say, the project really covered a really broad range of questions and themes. However, I am aware that it was then narrowed down, I suppose, into 4 key lines of inquiry. So I wanted to know a bit more about them and what were the main findings based on those 4 key lines of inquiry.
Yeah, so we had these 4 key lines of inquiries, which were basically like these bigger questions that we wanted to find possible answers to from the interviews and the feedback and the literature review as well. So the first one was we wanted to look at the best practices in engaging with lived experience possible. What are the ways to really meaningfully engage people with lived experience? And from our research, we find that having actually meaningful levels of engagement is important. So this means that the participants or the individuals with the lived experience are part of all the stages of the process or the policy formation or this kind of decision-making process, meaning that they have this kind of sustained involvement, that they're able to themselves create and design the process, however, whatever that means, then in that context, but also that they're able to evaluate and implement these changes that they are suggesting, so that they're also able to give recommendations, and then in the long run they're able to do these follow-ups, so that they are given information on their feedback and their contribution, but then they're also able to then give feedback on the process when it has actually been implemented. So that was something that the participants really emphasized in the workshops. And then the second key line of inquiry, or the bigger question that we looked at, were the barriers and enablers from when it comes to engaging with lived experience. And a barrier that can give an example was that the policymakers, they often express that there is this kind of established or existing ways of working for the public sector. And this means that often there is lack of training and a lack of understanding of working with lived experience. And this was a major barrier to then meaningfully engage with people with lived experience. And that they expressed that they would want to have more training and staff development when it comes to working on lived experience. And a policy officer also gave an example that, for example, the Scottish government doesn't have a public engagement expert or group that can regularly, engage with in lived experience. So that was something that they expressed was unfortunate when it comes to this environment. And then an enabler that I think is really important to note is that having an engagement that is inclusive and accessible, and a space that is inclusive and accessible. And this means that participants are able to either be offline or online, or give feedback or give notes, so that they are able to meet their individual needs, because not everyone is able to go either online or offline for these kind of engagements. And the participants, they emphasize this a lot. And that's why in our workshop as well, not everyone was able to be there in the workshop online. So then they appreciated to be able to give feedback. So they give their own input on their own time, whenever they had time, and then they sent the form. So that was important to be there as well. And then the third question was looking at the inclusion and quality. So what does it then mean to the people with lived experience and also the practitioners to then engage with lived experience? And here we see, again, that across the literature, that is this kind of staff development. So once they actually then meaningfully work with lived experience, that they are able to deepen their understanding and knowledge of everyday realities of lived experience. And it was pretty important that the policy officers, they also expressed that once they are then able to meaningfully do it, they appreciate that they are able to understand the realities of lived experience. And finally, we try to answer the question of what is the impact then on policy when it comes to engaging with lived experience. But here we can see that there's actually either limited or lack of research on the impact on policy itself. And this might be due because there's a limited impact evaluation in the long run, which we kind of have seen previously, that is a barrier or kind of downside of this, that often they end once the project has been done and there's no follow-up or monitoring and evaluation of how actually this work has impacted policy. But we definitely have seen that it impacts, the individuals themselves and the practitioners, that there's lack of evidence or limited evidence on the impact on policy itself.
That's fantastic. Thank you for such a succinct recap, again, based on the depth and breadth of the data that you gathered. It's really nice to hear that in such a concise manner. So the final question really is, what would you see are the top recommendations resulting from the project? And I think already just hearing a recap of the key lines of inquiry and kind of the key findings from those, I can have a pretty good grasp of what they might be, but I'd be curious to hear for you as the researchers, what are the top recommendations that resulted from this work?
Yeah, I do have to say, it is pretty difficult to say what are the top, but maybe a concise way to kind of give short topics in, again, having this meaningful levels of engagement. This means that there's a collaboration between all those involved, and also the co-production and creating inclusive spaces, meaning that individuals come as they are and are able to do as much as they can, but not and then also ensuring this clear expectation, clear goals, and communication. That was also important, that everyone kind of expressed that as long as everyone knows what is expected of them, then they also understand what the work is going to do. So then the outcomes are also clear, meaning that individuals are not told something that will not actually happen. So that is very important, to have clear expectations and goals. And then the monitoring and evaluation, that is a top recommendation, definitely, because that's how you're able to see the impact on the policy or the decision-making process in itself. But then it's also good for the practitioners for internal learning and to see what better to do the next time they do engagement as well. And then the training and support for participants and the practitioners themselves, again, just that the work itself can be meaningful as well. And then finally, funding and resources, meaning that there's enough resources and enough funding for the venues and the training itself as well. So I think those are some important things to note.
For me, I would completely agree with that, just based on what you covered earlier. The training and the evaluation and monitoring was really important. Making sure the expectations are communicated properly to participants also really, really important. And one that stood out for me when I was reading over the report as well was that of remuneration and recognition of participants' input. I think that's really, really important. And I was really I really appreciated the insights that the project gave on that, because I do think that needs to be developed further in our sector and in the public sector as well, that people need to get something in return for their time and for their input. Annie, is there anything you'd like to add to this?
Just really briefly, I think just what you've just touched on, the evaluation, that's actually one of the reasons why we wanted to interview policymakers, just to find out a little bit if there was any examples of how that's been done. So that was quite interesting, just to see if there were examples and why not. So yeah, that's kind of the reasoning why we did that.
That's it from me. I can only say thank you so much again, both for joining me today, for carrying out such a valuable piece of work to the Alliance and to, I think, many beyond the Alliance in the third sector and the statutory sector, and wishing you both a lovely day.
Having us.
Thanks, Francesca. Cheers.